Through the saints, through Our Lady, through our Lord, we prevail. Doing this video because I'm thinking about taking down my positive video about the VA. First, they called me on Friday and said that their ultrasound tech was going to be gone for the day. They'll be back on Monday. A place as large as that, and the ultrasound, they only have one tech. I don't know. But, maybe. It's not like pregnant women would go to the VA for care. That doesn't happen. So maybe. Uh, but nobody, looked at my blood panels. My glucose, blood glucose is 267, and my urine glucose was 1,000. Nobody did anything about it, So I had to take measures over the weekend. And I'm throwing a few ketones. It's not a lot, but still, it's the beginning of ketoacidosis. This happens every time I go there. Urine glucose high, blood glucose high, and people think I'm hypoglycemic. People confusing hyper and hypo? I don't know. I'm sick of it, and it's obvious. Some of my issues with urine now are explained. Ammonia smell. Yeah, you're throwing ketones, dude. And if your urine smells like ammonia, there's a different smell. You didn't drink enough water. Okay, that's a very different smell when you smell ammonia. Like Grandma used to clean the house and clean the floor with ammonia. That's bad. You need to immediately get some hydration, Pedialyte, or make your own oral hydration solution out of, if you're diabetic, you need to minimize the sugar. Use some kind of very little fruit-based sugar, or, you could even maybe put in a piece of, in a blender, put a very tiny bit, like a quarter of a teaspoon of Himalayan pink salt. Then you could put in one of those little tiny squares, or not a square, but I forgot what they call them. Not a half of an orange, but one of the little rounds, one of the segments. You could throw one of those in, only one if you're diabetic. If you're not diabetic, throw in the whole orange, except for the peeling, of course. And grab the seeds out of there. Last thing you need is, some kind of abdominal discomfort because you're eating seeds. Throw all that stuff in there, and maybe 1/8 of a teaspoon of baking soda. I guess that's about it, And then you blend it with fill your pitcher up halfway to 3/4 with water. You want purified tap water or mineral water or something like that. You don't want unpurified. Why tax and tear out your system even more by giving it water that's not that great, or even distilled water. The problem though with distilled water is it's distilled. There's nothing in it, nothing of mineral or vitamin value. So that's your homemade oral hydration solution. Of course, I'm not a doctor. I do not have medical-related initials. My initials are related to something entirely different than medicine. So, consult your physician to see if, for your health, that's the appropriate uh, formula for oral hydration fluid. Or is it oral hydration solution? I forget the initial. There's an actual initial for it. Home oral hydration solution. But it's basically the same stuff you find in dextrose that they give you at the hospital. Give or take, pretty much the same ingredients. But anyway, so I had to do that and eliminate every possible piece of sugar, and my carbs had to go to absolutely whole grain. And I had to eliminate every possible thing that could even become sugar. Like I said, even bread had to go to entirely whole grain, which still, but it's what we have in the house. Uh, but so I'm thinking about removing that video. If you're out there and you have, diabetes, and you're every time you go to the VA, your sugar is elevated, and they refuse to give you a diabetic diagnosis, my suggestion is walk away. Just walk away. Because every time that your sugar goes high, you start throwing ketones. That's kidney. That's very minutiae if you're a few. But if you're throwing many ketones, you may not be able. You're in ketoacidosis. You need to go to the hospital. But if you're throwing few, still that's kidney damage. You only have so many nephrons. That's the little filtery pieces, the sponge inside your kidney. You can't grow them back. Sadly, not yet. Maybe someday as stem cells you can, but not yet. Once they're gone, they're gone. Um, yeah, and the more that your body is kicking sugar out because it's ketoacidotic, that also damages your kidneys. It's called crystallization. It crystallizes the nephrons, which is also bad. You don't realize how sensitive the kidney is. Very sensitive organ. You can survive with one, but your life will be significantly impacted. But you can survive with one. You can't survive with none. You'll have to have your blood run through a dialysis at least once or twice a week for the rest of your life. And a side note on that: rarely are those cheap for somebody to give them to take home. Rarely. Those machines are very expensive. So yeah, somebody who had to get dialysis. I don't even know if there's portable dialysis. I've never heard of it, but there probably could be. There's portable MRIs, believe it or not. Um, Much smaller units, but still they have the same function. But yeah, so I'm thinking of taking down that positive comment. 'Cause I haven't heard from anybody, and I called, and nobody called me back. It was almost an hour ago. And they should know what's going on because they see this stuff. When they put it into their system, it goes to the providers. It goes to the department that is getting the referral for ultrasound. In my case, yeah, everybody is carbon copied in this stuff. And I mean, the only way that I would see that a team would be at odds for this is if the doctor is so busy, they have um, their nurses reading all their messages, reading all the traffic of their patients, I guess, or MSAs, God forbid. These are not medically qualified people. They should not be in the loop. But anyway, somebody thinks they're funny. They call them an MSA. Every time I hear that, this shows how immature and how absolutely wasteful that some people are within the VA system. And I'm sure if I dug enough, I would find something there relevant to just relevant to my investigation if I dug deep enough. But anyway, these are not medically qualified people, folks. Some of them don't even know medical terminology. These are not the people you dump all your medical issues on because they don't understand. And sometimes the messages that get through are wrong. Like my doctor thinking I'm hypoglycemic because the message getting through, either it's the MSAs or it's the LPN, one of the two, are giving in messages that are wrong. Hypoglycemia, hyperglycemia, very different treatment protocol. Very different. Unless, of course, it's critical. Then it's the same treatment protocol. ER, hydrate. You don't need an insulin injection, though. Obviously, you need sugar. But yeah, just be careful, folks. And if your situation's like mine, demand better treatment. And if you're gaslighted, go somewhere else. I know if you live in this part of Michigan, you don't have much choice. Um, it's I don't know. I don't know. I mean, we've had a couple of good times with Covenant, but several bad providers enough that we severed the relationship. But we've had a couple of good times with Covenant, where we were cared for well. Um, by Michigan, which used to be St. Mary's. It's not St. Mary's anymore. I wish people would stop saying that. It's not St. Mary's. When all of the sisters' pictures are removed, all of the priests that were there, everybody's pictures removed, every icon is gone, every crucifix is gone. The pictures of the nursing students who are also sisters, they're not there. But yet the nursing student pictures are there. They've whitewashed the whole thing. It's like it was never a Catholic hospital. Catholic teaching hospital. One of the few in the state. And it's time. But yeah, it's just weird seeing only secular nurses' pictures. All the sister nurses, their pictures are gone. Yeah. Anyway, and then you see a baptismal font that's turned into a meditation babbling brook font. The altar's gone, lectern's gone. Yeah. Anyway, I mean, some of the care there is still good, but sometimes you get troublemakers there too. So I don't know. I don't know. I have to pray about it and see what to do.